Right now at this point, we're talking to pharmacies to find out how much dosage that they do have. We want to make sure that if they do run into an issue, they contact us. We can work with them to supplement their supplies.
You saw that yesterday at 5 o'clock during our newscast when we brought a health alert for you. We've got it continuing this morning. We've been talking to you about it on Daybreak all morning long. It's shaping up to be one of the earliest and most severe flu seasons in recent years. And now that means some pharmacies are running out of some of the medications that are used to treat it. Of course, this is a serious issue here. And this morning, Kim Greenwald, the infection control coordinator with St. Mary's Healthcare, joins us in studio to talk a little bit about this. So let's start off with that subject. Lisa LaPlante with the health department was talking about that yesterday. There seems to be some kind of shortage of medications. What are those and what kind of shortage are we talking about here?
Primarily, we're talking about the Tamiflu here, that there's a lot of prescriptions being written for Tamiflu, and they're trying to fill them, and there's more demand than there is supply at this point in time.
That's just something used, though, to treat the flu. It can, what, shorten the duration of it?
Yes, it can shorten the duration a bit, and it makes the symptoms a little less, but it doesn't make it go away. You still have to go through all the flu experience. It just kind of lessens the flu experience.
Okay, so something that somebody should keep in mind here. Might want to get that flu vaccine. We'll talk about that in just a second, but first, the other pressing issue here is that emergency rooms all across the country, even in Canada, basically North America, are filling up with people who have the flu, and that's a concern, though, because it's jamming up the system, right?
Absolutely.
And that is something you guys are experiencing at St. Mary's?
We certainly are. A lot of folks coming in with flu complaints. You know, the thing to remember if you're coming to the emergency room for flu symptoms is if you don't have any other, I guess what I would really say it in a more positive way is to say that if you have a fever that you can't bring down with fever reducers, if you have trouble breathing, if you have other health issues like diabetes or other breathing problems, and those things can't be managed at home, then you should come in and be seen. But if it's just, I have the flu, and there's not a whole lot that we can do for you except encourage you to do fever reducers at home, drink plenty of fluids, and rest. Chicken soup is always good too.
And this can affect people that are really needing to see some emergency help because it could slow it down for them. And you're also asking people that have the flu not to go to the hospital to visit people that are sick there now.
Indeed. What we would really like is for anybody who's ill, not feeling well, feeling poorly, however they describe their state of health where they're just not up to par, not to come visit. That would be perfect, because we just don't need more sick people to come visit sick people.
Yeah, exactly, and maybe spread it around there.
Correct.
And continue to exacerbate the problem here. And it's not too late to get that vaccine, though. Still effective at this point, right?
Absolutely. Just remember that if you get a vaccine, it takes 10 days for the antibodies to develop. So in theory, I could get a vaccine today, but in 4 days I could still develop the flu because I just don't have the antibodies ready from the flu vaccination available.
Sooner better than later then when it comes to that, of course.
Absolutely.
All right, and there's no shortage of the vaccine, it's just some of those medications that treat it.
Correct.
All right, thank you so much, Kim. We appreciate you coming in to talk about this.
Thanks.
This is something that's affecting practically everybody. Somebody knows somebody with the flu.